Hello, I'm Dr. Inman. This is a lecture on infection in domestic animals in general. Now, when we talk about infection, we're talking about bacteria, fungi, yeast, viruses, unicellular parasites, essentially, all kinds of rickettsial organisms, all kinds of infectious agents. We're not talking about necessarily, parasites such as helminths or worms, but we are talking about unicellular parasites such as toxoplasmosis, etc., etc. Now, adjusting the animal essentially does very little for infectious disease conditions outside of increasing the blood supply, which can be worthwhile. If you notice that we almost always adjust these animals routinely because the chances that they have vertebral subluxation complexes or neurological interferences are close to 100% anyway, so this is going to be beneficial. However, the majority of our approach is going to be delivered by delivering frequencies to the specific tissues. For instance, if we have a specific area of infection, we can double laser, cross the laser over like this, or we can put the laser with the preset head at the thoracic inlet and laser the animal's body. The magic number for all infectious disease conditions is 784, and people will call me up and say, well, what's the frequency for MRSA, for instance? If you'll notice on our website's list, we have actual frequencies specific for MRSA, but the underlying frequency is 784 for all infections, for yeast, fungi, bacteria, viruses, etc., etc., unicellular parasites. And the reason that is it does not kill the bacteria, fungi, yeast, etc. What it does is it engages the body to attack infectious agents that aren't supposed to be there. One of the other questions that we're given is if, in fact, this allows the body to attack all infectious agents or bacteria, how come it leaves the normal bacteria, the normal bacterial flora alone? The human being at 200 pounds is supposed to have about 3 pounds of good bacteria in their body, and how come this doesn't sterilize that? Well, the fact is the body seemingly knows, the immune system seems to know what good bacteria is and bad bacteria is, and so what we're doing is we're engaging the section of the mitochondrial DNA of the killer cells and also the lymphatic system in an attempt to try to get them to gear up and attack the replicating parasitic, deleterious infectious agents, yeast, fungi, and bacteria. That's why this technology works both for bacteria and for viruses, as there is no really true antiviral medication, but there are antibacterials. And again, we have disease processes that we use when we start talking about treating MRSA, and that's methoxycin-resistant Staphylococcus aureus, which we've been successful with this particular technique. I would mention that to you and have you go to the website. Vomtech.com will give you more information about frequency, specific low-level laser therapy, and how to give that information and apply that into your practice. So we're going to lecture on infections in general and how we treat it. The one number you have to remember is 784. Also, we'll use 230 for lymphatic drainage and some other frequencies to increase blood supply, but that's delineated in the information in the modules associated with basic and advanced laser therapy, which we deliver in a course on the vomtech.com website. Thank you, and have a great day.